Our top story this morning, the World Health Organization. We await their meeting in Geneva later on today. The WHO considering declaring this new coronavirus an international public health emergency. That announcement is expected around 1 p.m. Eastern. We are, as we wait for that decision, learning more about the virus, learning about new deaths and new cases. So here's some of what we know so far. Wuhan is the epicenter of all of this. Chinese officials have now told us the number of deaths has risen to 9, with 473 confirmed cases. The illness has spread as well from Wuhan out into, for example, Thailand and into Taiwan, South Korea, Japan. This morning, Hong Kong announced its first case. And yesterday, we learned that there was a confirmed case in Washington state. U.S. officials confirming a 30-year-old man in isolation after traveling to there from Wuhan. I'm so pleased to introduce to you our next guest, Dr. Peter Deszak, who is the president of EcoHealth Alliance. Now, that is an organization that has done some absolute landmark research on emerging diseases. It tracks their origins in spread. SARS is one of the areas in which he's done a lot of work. And Dr. Deszak joins me from New York this morning. Welcome to our program, and thank you for being with us.
Good morning, Heather. Pleasure to be here.
Can we begin looking ahead to that WHO meeting today when they decide whether they're going to declare this to be an international health emergency, a public health emergency of international concern is the formal wording. How likely is it they will make that declaration, Dr. Deszak?
Well, I think it's anybody's guess right now because, if we look back to there's been a series of Ebola outbreaks in the Congo. And the World Health Organization met repeatedly and failed to call it a public health emergency for a number of times. So it may not go that way right now. Let's see.
If it does, or maybe if it does eventually, if it continues to grow and spread, which we'll talk about, why is that designation important? What effect does it have, and what does it change?
Well, the World Health Organization is the only intergovernmental, multilateral agency that deals with global health. So this is the organization we look to when there's an international disease problem. And of course, that's the problem with infectious diseases. Once they start spreading, no one government can control that. We need governments to come together to try to deal with this global outbreak.
So that's why we await with interest at what the WHO does today. In the meantime, we are hearing of different countries and different governments responding in their own way, enhanced screening at airports and within hospitals as well. What do you think so far of the response to this new virus?
I mean, look, there's really good news about this virus, and then there's some bad news. The good news is it doesn't look so far as lethal as SARS was. SARS had about a 7% mortality rate. This virus has killed about 2% of the people it's infected. And those tend to be people with predisposing conditions and elderly. The other thing is we've got a good diagnostic test. So countries around the world are already able to accurately test patients and confirm whether they've got the virus or not. We didn't have that with SARS. On the other side of the coin, we've got possibly the worst timing of any outbreak ever, because this is Chinese New Year. We're coming up to it now. And, we have 3 billion individual trips that are likely to take place in China. Even if the government tries to clamp down on some of that, it's really likely that this virus will spread within China and then be able to get out into more countries.
So the good news and bad news, on that last point you just made, I'm going to bring up on screen a map that from your organization, EcoHealth's Flight Risk Tracker. You have an app, and this is really interesting because it shows the likely air travel out of Wuhan, the epicenter. So as we look at this, what does this tell us about where this virus is likely to go?
Well, what this app does, and we developed this with Department of Defense in the US and Homeland Security, to actually track the risk of incoming infected people into the US. But it works for every country. And it also tracks the likelihood of people taking connecting flights, which is really important because that's a way for, you can control against direct flights. But if people are going to transfer and move on a connection flight, there's a risk there. What it tells us is that the biggest risk right now, and this map goes forwards for the next few days over the Chinese New Year period, the biggest risk is within Southeast Asia, but there is substantial risk internationally. So I wouldn't be surprised if we see cases, infected people arriving at airports across Europe, the US and Canada too. Luckily, we're ready. Canada's got a great public health agency. You're already screening airports, and hopefully we'll be able to catch those infected people. My bigger concern is for countries like Vietnam, Indonesia, Malaysia, Bhutan, where people will fly to, and the quarantine facilities, the screening facilities might not be as accurate.
It's interesting. We have done some reporting on Canada's preparedness and spoken to our chief public health officer. About 4,000 travelers from Wuhan are scheduled to arrive in Canada over the next weeks. So there is an anticipation of cases here, but there, as you've just indicated, seems to be a sense of readiness and having learned lessons from SARS. You mentioned a couple of parallels from SARS already, but are there any others that we should be particularly aware of here?
Well, one disturbing bit of news that came out of China a couple of days ago is that healthcare workers were infected. We don't yet know if there have been these so-called super spreader events that really drove SARS to dramatically spread at a point in the outbreak where one person was able to infect multiple people, 38 people in one case, 23 in another. We don't know if that's happened, but we do know that healthcare workers in China have been infected by patients, and it might be multiple people. That's a cause for concern if we start to see that. And then what that means here is that if an infected person is able to, let's say they're not very sick yet and they don't get picked up on screening, and they go through and then go into their local community and start to get sick, and people aren't ready, that means that the virus can then do secondary spreading within the country of arrival. And that's a big concern for healthcare agencies across the world.
Okay. I have two quick questions, if we could, Dr. Deszak. Number one, China's been rather forthcoming, it seems, in all of this. That was one of the big problems in SARS, lack of transparency, trying to keep things concealed, the magnitude of the spread. They're holding daily briefings in China. They're updating the numbers. I'm wondering what your thoughts are in terms of, it's important to get this information from a source. What do you think about how China is handling it this time?
Well, China is also going to take part in the public health emergency meeting today with World Health Organization, which is really good. I think they've done a fantastic job, as good as you can expect for any country to do. Outbreaks are really difficult to control. People panic, there are rumors, there's misinformation, and China was criticized a lot during SARS for not being completely open early on in the outbreak. We're only 3 weeks into this outbreak. We already know what the virus is. We've got the full genetic sequence. We know that it's spreading. And they've been open and honest about that. And I think that's really going to help a lot in controlling this outbreak.
So as I've listened to this conversation, although there's bad, I'm hearing tone of optimism here. Every time you hear of a new virus, of course, everyone dreads the global pandemic that may be, devastating. Do we have any indication whether, at this point it's early on, is this it? Or does it seem to be not?
Well, it's really 50-50, and I'm optimistic. That's why you're hearing optimism. But it could go either way. If we start to see super spreading events, I'm concerned if people are traveling to countries that don't do adequate screening. If a few people get through the net and then start to spread within countries and seed further outbreaks, that's going to be a problem. And don't forget, over the last 10 years, China's changed its travel patterns significantly. A lot more people are traveling internationally. A lot more people are traveling to other developing countries in Africa and across Asia. So I expect we're going to see cases there, and that's going to be harder to contain. So we're all keeping our fingers crossed, and we're trying to be as optimistic as possible right now.
Dr. Deszak, let's keep in touch if you would, because your perspective is so important on this, and we'll be watching it very closely in these days and weeks to come. Thank you for the time today.
My pleasure, Heather. Cheers.
Dr. Peter Deszak in New York.